Healthcare as we know it is evolving. Thanks to various teams of scientists and developers, the industry has seen enormous changes, and it hasn't finished progressing yet. Here at N2K, we take an in-depth look at just some of the technological advancements transforming the treatment of patients around the world. By far, one of the biggest teams working towards changing medicine is British artificial intelligence company DeepMind. After teaming up with Google back in 2014, the company have begun to collaborate with medical professionals in order to integrate their technology with healthcare. One of such establishments is the world's largest eye hospital, Moorfields in London. DeepMind have been working alongside Moorfields to completely revolutionize the way professionals carry out eye tests. And they've done so by looking into how technology could help to analyze scans.
It will allow us to get much earlier detection of these blinding diseases, and as a result of that, I think we'll get much earlier intervention and much earlier treatment for these patients.
And while this work demonstrates the move towards the use of more advanced technology, DeepMind have also been focused on the bigger picture. The team are determined to overhaul the current health IT systems of the UK with the use of artificial intelligence. Their core mission is to support the health service by digitizing the data and ultimately enhancing patient care. A transformation that could one day be applied to systems across the globe. Co-founder and head of Applied AI, Mustafa Suleiman, reveals why the team chose to focus on medicine.
There really is no other sector that I can think of in the world that is so far behind the cutting edge in terms of technology. And if we're successful, that represents a massive opportunity for us to have a beneficial impact.
But there are scientists also working hard to achieve change on a much smaller scale. Engineers at UC Berkeley in the US have built the first dust-sized wireless sensors that can be implanted into the body for multiple medical needs. Most prominently, they hope to connect externally to the sensors to monitor internal nerves, muscles, and organs in real time. Although still in the prototype phase, these tiny devices could one day transform the way we keep an eye on our bodies. And they aren't the only team working towards a minuscule medical future. At MIT, researchers have developed an ingestible origami robot which unfolds itself from a swallowed capsule to take on specific tasks within the body.
The robot can remove foreign objects, it can patch wounds, or it can deliver medicine at designated locations.
The robot can then be controlled from outside of the body, but the team hope that one day it will be able to take full control all on its own. Next, we meet the team of doctors using virtual and augmented reality to change the way people look at medical training. Medical Realities is a healthcare company dedicated to using the most advanced technologies to ensure the best care for their patients. And they do so by using cutting-edge VR and AR content to train doctors, surgeons, and medical students. Which CEO of Medical Realities, Steve Dan, reveals will vastly help current and future medical professionals.
We see the future of virtual reality and augmented reality being very much based around training and education, particularly in the medical fields. But also, virtual reality can be used for therapy and also pain relief as well. So that's another way that VR and AR can help patients directly.
And we travel to Cincinnati's Children's Hospital in the US to see how another form of modern technology is also being used for training purposes. Although this time, they're using hardware instead of software. In order to get a better look at the work needed in an upcoming complex heart surgery, the doctors in Cincinnati 3D printed a full-scale model of the organ using MRI and CT scans. This enabled the surgical team to plan the procedure by first performing surgery on the model before taking the patient into theatre. A practice that Dr. Rick Kosozek believes has transformed the process entirely.
When we walked into the operating room, we all understood exactly where we were going to put these lesions, how we were going to talk, and it was remarkable how quickly that aspect of the surgery went.
And some gadgets have even received worldwide acclaim for their development. Will Broadway created Isobar during his time at university after noticing a hole in a particular medical process.
The problem with the current vaccine distribution system is that they're thermally unstable, so they're unable to provide the temperature ranges that vaccines need.
The mobile delivery system provides cooling effects and much-needed stability during transit in remote regions. And it's built up 3 components: a backpack, a cooling unit, and a propane burner, meaning in emergencies it can be recharged anywhere in the world. With the help of technology, advancements in medicine are being made in both the process and the practice. This incredible abundance of apps, sensors, and information has already kicked off a massive shift from traditional medical practices, and this is only the beginning.